Hi, good evening. Welcome to Monday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. So I think we don't have exam on this coming Saturday, right? But we have exam on the very next Saturday. I think November 23rd as well as November 30. So how's your preparations going? Hmm? Okay, so let me check how many of you have joined this live segment. So then I'll give you a sample question from part B, and for the same I'll give you 2 minutes, and this 2 minutes you can take as a preparation time. So I'll show you the question on the screen so that you can read the question and then underline the keywords from the question, then identify your answer by reading the paragraph. Okay, and when you identify the question, always identify which category of question is this, as well as what are you reading for in the category, and you can identify the answer on the basis of that. Clear? So here comes the question. Yes, welcome back. Good evening once again. Hi, Beulah. Rebecca, good evening. Hi, Neethu, good evening. Yes. So, how was this question? The question. I think this is a little bit lengthy. I mean, the options are a little bit lengthy, as well as the paragraph, but I'll read the question, then let's discuss the answer here. The purpose of this guideline on the use of anesthetic gas is to. That is the question. So, what are the keywords from the question here? The purpose of this guideline. So, usually, as we know, they will ask questions based on the purpose. It will be in the third category, maybe an email, memo, or a notice. But here, as you can see, this is a guideline. Already we പറയുന്നുണ്ട് this is a guideline. Very directly mentioned, this is the category which is a guideline. So, the first step is read the question. So, we already read the question. And second step, you can underline the keywords from the question. So, what are the keywords from the question? And most probably, almost every student, you have this concern or you have this doubt like, okay, whether it is needed to or necessary to underline the keywords. അങ്ങനെ ഒരു ഡൗട്ട് ഉണ്ട് നമുക്ക്. Keywords underline ചെയ്യണോ, അത് ഇമ്പോർട്ടൻ്റ് ആണോ? So it is important. Because keywords എന്ന് പറയുന്നത്, from those important words or from those keywords, you will get the answer. Those words will help you to identify the answer. ആ keywords ആയിരിക്കും നമ്മൾ എങ്ങോട്ടേക്ക് ലീഡ് ചെയ്യുക towards the answer. Okay, so please do underline the keywords. Don't forget to underline the keywords, right? Then, so what are the keywords from the question? So my keywords, guideline, then, yeah, guideline, anesthetic, and gas. Okay, so these are the keywords from the question. And after underlining the keywords, it is very important to understand the question. Alright, understanding the question. And you guys now know how to understand the question. So, how we are understanding the question based on the category of the question. Okay, so which category is this? This is category. And very simply, you can say this is from the first category, which is a guideline. See? Alright, so this is from the first category, guideline. And what are you reading for in the first category? Yes, let me know in the comment box. This is from the first category and this is a guideline. What are you reading for in the category? എന്തിനു വേണ്ടിയാണ് നമ്മൾ guidelines വായിക്കുന്നത്? Let me know in the comment box. ഒന്ന് comment ചെയ്യാമോ? Let me know. Hi Gigi, Anu, Kavita, Anju, good evening. Yes. So what are you reading for in this first category? നമ്മൾ എന്തിനു വേണ്ടിയാണ് വായിക്കുന്നത്? We are reading for the details. Okay, so what are the instructions mentioned here? What are the principles mentioned here? What are the recommendations that we have to follow? So we are reading for the details. And which lines are important? I can say the first sentence is always important. Clear? I'm not saying that first sentence will be the answer. The answer ആയിരിക്കും നല്ല ഞാൻ പറയുന്നത്. But that first sentence, maybe that first sentence will help you to find out the answer, or you can eliminate any options from those that particular first sentence. All right. Yes. Hi Anita, good evening. Yes, Gigi, we are reading for the details. Yes, Beulah, we are reading for the details. Hi Limna, good evening. Yes, Glenn, we are reading for the no. Okay, it's not purpose. See, this is from the first category. So we are reading for the details. Third category, we are reading for the purpose, right? Okay. So we are reading for the details. Yes, Anju, we are reading for the details and first line is important. Very good, Neethu and Beulah. Yes, Anju, first line is important. I can say the first sentence is important. So, now, after understanding the question, then now we are going to read the options. And first of all, let's check whether this question is a complete question or an incomplete question. Either an incomplete question alle. Why this is an incomplete question? Because there is no full stop, no question mark at the end of the question. Clear? So, what we are going to do is, let's connect with your options. Okay, so anesthetic gas is to emphasize the importance of patient safety during its administration. During administration, which means providing something, or you can, administering the medicine, which means we are providing the medicine for the patient. So, my keywords, emphasize, importance, as well as administration. And second option, anesthetic gas is to identify those patients who are most at risk after it has been used during a procedure. So, identify a risk and procedure. And option C is anesthetic gas is to clarify the criteria for deciding whether patients who have received it can perform certain tasks. My keywords, clarify, criteria, and then deciding or received. These are my keywords from option C. And as you can see here, these options are a little bit lengthier than usually we are dealing with the keywords or dealing with these options. But yeah, let's see what is the correct answer here. So safe use of Entonox gas for short-term pain relief. And we are using this gas for pain relief. Clear. Patient information. So yes, hi Linda, good evening. Yes, Bincy. John C. Hi John C, how are you? Then Gopika. Okay, we are reading for the details. Yes, Anju, first sentence is important. Hi Helen, good evening. Yes. And I'm going to read the paragraph. Okay, ഇനി നമുക്ക് paragraph വായിക്കാം. Safe use of Entonox gas for short-term pain relief. Patient information. All patients receiving Entonox must be given. So, and how we can identify the category. Suppose in the question already they've mentioned this is from the guideline category. The first category ആണെന്ന് already അറിയാം because already mentioned here. Suppose if it is not mentioned, what will you do? ഇതിനി കൊടുത്തിട്ടില്ലെങ്കിൽ നിങ്ങൾ എന്ത് ചെയ്യും? Suppose the guideline or the category is not mentioned here, then what will you do? Let me know in the comment box how will you identify a category if it is not mentioned in the question. നിങ്ങൾ എങ്ങനെ ഐഡൻറ്റിഫൈ ചെയ്യുന്നു കമൻറ്റ് ചെയ്യാമോ so that others can help. Yes, your comment will help others. Yes. How will you identify if the category is not mentioned? Category കൊടുത്തിട്ടില്ലെങ്കിൽ നിങ്ങൾ എങ്ങനെ ഐഡൻറ്റിഫൈ ചെയ്യും? On the comment ചെയ്യാമോ? Suppose it is a guideline category. അത് guideline ആണ്, but that guideline ഉള്ളത് it's not mentioned in the question. The category is not mentioned in the question, then what will you do? എന്ത് ചെയ്യും നമ്മൾ? Yes. You can do one thing. If it is a guideline, you can see a lot of words like ഏതൊക്കെ words കാണാൻ പറ്റും? Must. Okay, must. Have to. Then something important. Compulsory, necessary, required to, should. So these words which indicate something necessary, important, compulsory. Nirbandha aanu ennu kanikkunna those kind of words you can see in a guideline. Alright. And other words I can say follow. Okay, because guidelines in the what are guidelines, which means a set of rules and regulations that you should follow. Or instructions, principles that we have to follow. Our follow cheyanam parayna some kind of words will be there like follow, comply, 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 and abide, 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 as well as adhere. So these kind of words will be there. Not always all the time, but you can see a lot of words like this. Okay, so we can decide, okay, this is from a guideline category. As well as if the question is framed in these three orders, like how to do something, when to do something, or why it is important to do something, it will be a guideline. Clear? Yes. Adhere, yes, important, very good, Neethu. Special words like must, have, need to, very good, Sharon. Yes, Sharon. Okay, Neethu, we can see some words like abide, follow. Hi, Nimi, good evening. Yes, Jasmine, good evening. Okay, so these are the important words that you can see when you read a guideline. Then, all patients receiving Entonox must be given verbal and written information regarding the drug. So, we have patient information leaflet that is mentioned in the particular bracket regarding the drug. When Entonox is used as a sole analgesic or sedative agent, driving and use of complex machinery is not recommended until at least 30 minutes has elapsed after the administration of Entonox has ceased. Option B, healthcare professional has assessed that the patient has returned to normal or mental status oriented to time and place. And the third one, the patient feels that they are competent to drive or use machinery after the relevant procedure is completed. That is, there is no residual drowsiness or lightheadedness. Additional care is needed when Entonox is administered to a patient who has been given associated medication. So that's all about the paragraph. Even though it looked like, a very large para, it is a very small para with a lot of, bullet points. Okay. So let me know in the comment box. What is your answer? നിങ്ങളുടെ ആൻസർ ഒന്ന് കമൻറ്റ് ചെയ്തേ. യെസ് അഞ്ജു, ഹൗ ടു ഡു സംതിങ്, വെൻ ടു ഡു സംതിങ്, വൈ ഇറ്റ് ഇസ് ഇമ്പോർട്ടൻറ്റ് ടു ഡു സംതിങ്, ദെൻ ഇറ്റ് വിൽ ബി എ ഗൈഡ് ലൈൻ. ഇഫ് ദ ക്വസ്റ്റൻ ഇസ് ഫ്രെയിംഡ് സോ ഇറ്റ് വിൽ ബി എ ഗൈഡ് ലൈൻ അല്ലേ? ഓക്കെ, വെരി ഗുഡ്. സോ ടെൽ മീ വിച്ച് വൺ ഇസ് യുവർ ആൻസർ? നിങ്ങളുടെ ആൻസർ ഒന്ന് കമൻറ്റ് ചെയ്തേ. വെദർ ഇറ്റ് ഈസ് ഓപ്ഷൻ എ, ബി ഓർ സി. എ ആണോ, ബി ആണോ, സി ആണോ നിങ്ങളുടെ ആൻസർ? ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? Let me check your answer, please. Whether it is A, B, or C. Emphasize the importance of patient safety during its administration, and identify those patients who are at risk after it has been used during a procedure. Or option C, clarify the criteria for deciding whether patients who have received it can perform certain task. Yes. Anyone with the right answer, let me know. ആർക്കും ആൻസർ കിട്ടിയില്ല? Okay, so answer is option C. Clarify the criteria for deciding whether patients who have received it can perform certain tasks. That is the correct answer. Okay, so now let's find out why, as well as how we can eliminate other two options. എങ്ങനെ ഓപ്ഷൻ സി കിട്ടി പ്ലസ് എന്തുകൊണ്ട് നമ്മൾ ഓപ്ഷൻ എ ആൻഡ് ബി എലിമിനേറ്റ് ചെയ്തു? Alright. Then, so what about option A? Anesthetic gas is to emphasize the importance of patient safety during its administration. Where is it mentioned while providing this particular medicine or this gas, we are just looking for the patient safety, and that is important. Alright, see, as you can see here, when Entonox is used as a sole, analgesic or sedative agent, driving and use of complex machinery is not recommended until, and then they have mentioned some set of criteria here. Okay, the all in all, I can say in a nutshell, this is completely a particular criteria or strategy and a method is mentioned here, that administration of this particular anesthetic gas. But we cannot say, or it is not mentioned here, importance of patient safety during its administration. So we can eliminate option A. It is not mentioned. What about option B? Identify those patients who are at, again, where is it mentioned? We are identifying patients who are at risk after this. So again, I can say it's not mentioned anywhere. So answer is option C. Clarify the criteria. So this is all about a strategy. And so 3 different points mentioned here as strategy to do something, a method, how to do it. So that is option C. That is the correct answer. Yes, very good, Neethu. It is not mentioned. Hi, Trisky, Shanta. Yes, good evening. So that's all about part B. So now let's deal with part A, and we have a self-prepared material for part A today. And I don't know whether you guys have done this material, because every day, I think before 11 a.m. we will upload the material. So please do take a printout of the material. Don't do, look into your on screen and do the material, because it will be very difficult for you. Plus, you cannot underline the keywords. Yeah, of course you can underline the keywords because you are just doing everything by your pointer or your finger. So yeah, definitely you can underline the keywords, but I just prefer you to do, I mean you can take a printout of the material from this particular page. I mean, we have a page called Neethu Academy Reading. So take the printout of the material from that page, and you can do the material. All right. Yes. So yeah, very small text I can see here, text A, B, C, and text D. So now I think you guys are experts in doing part A, right? But definitely majority of the students are not able to do part A within short period of time. I mean, I can say 15 minutes of time. So part A, or the reading, I will talk about reading. So reading as a module, this is all about 1 hour session, and out of this 1 hour you can take maximum, not maximum, exactly 15 minutes for the completion of part A, isn't it? Yes. Okay, and how many text we have? നമുക്ക് എത്ര ടെക്സ്റ്റ് ഉണ്ട് പാർട്ട് എയിൽ? So we have 4 different texts in part A, that is text A, B, C, and D. Just imagine, suppose a doctor or your in charge is asking you a lot of questions by giving a soft copy or a hard copy to you, and you guys are reading it very fast, and they are setting a limited period of time, for example 10 minutes or 15 minutes, and within this short period of time you guys are going to read everything, and you guys are going to answer to their questions. So likewise, part A is going to analyze whether the student is able to do something within a short period of time. Okay, ഒരു സ്റ്റാഫായിട്ട് വർക്ക് ചെയ്യുമ്പോൾ, അല്ലെങ്കിൽ ഒരു നേഴ്സായിട്ട് വർക്ക് ചെയ്യുമ്പോൾ, whether that candidate or aspirant is able to do a particular procedure or a particular task within a short period of time. Okay, നിങ്ങൾക്ക് അതിനുള്ള ഒരു കേപ്പബിലിറ്റി ഉണ്ടോ എന്നുള്ളതാണ് they are just looking forward. So part A is all about 4 different texts, A, B, C, and text D. Okay, then how many questions in part A? So I can say 15 minutes and 20 questions in part A, and this 20 questions they have categorized into 3 different sessions. As you know, 1 to 7 set of questions can be called. എന്താ പറയുക, 1 to 7 set of questions? Yes, ഒന്ന് കമൻറ്റ് ചെയ്തേ. 1 to 7 set of questions എല്ലാവരും ഒന്ന് കമൻറ്റ് ചെയ്തേ. വാട്ട് ഇസ് 1 to 7 set of questions called? Then 8 to 14 as well as 15 to 20. എന്താ പറയുക? 1 to 7 set of questions can be called match the following questions. So what is match the following questions? ആദ്യം നമ്മൾ ക്വസ്റ്റൻസ് ചെയ്യുന്നതിന് മുമ്പ് സപ്പോസ് വെൻ യു ഗെറ്റ് എ മെറ്റീരിയൽ അറ്റ് ദ ടൈം ഓഫ് യുവർ എക്സാം, ഡോണ്ട് ജസ്റ്റ് ബോദർ അബൌട്ട് ഓക്കെ വാട്ട് ഇസ് ദ ക്വസ്റ്റൻ, വെദർ ഐ എം ഏബിൾ ടു ഡു ദിസ് ക്വസ്റ്റൻ വിത്തിൻ ദിസ് ഷോർട്ട് പീരീഡ് ഓഫ് ടൈം, ഇസ് ഇറ്റ് പോസിബിൾ ഫോർ മീ. ഇതൊന്നും അല്ല നമ്മുടെ എന്താ പറയുക തോട്ട് പ്രോസസ്സിങ് വരേണ്ടത്. ദിസ് ആർ നോട്ട് യുവർ കോഗ്നേറ്റീവ് പ്രോസസ്. ഇൻസ്റ്റെഡ് ഓഫ് ദാറ്റ് യു ക്യാൻ തിങ്ക് അബൌട്ട് ഓക്കെ വെദർ വാട്ട് ഇസ് ഇൻ ടെക്സ്റ്റ് എ, എന്താ ടെക്സ്റ്റ് ബിയിൽ, വാട്ട് ഇസ് ഇൻ ടെക്സ്റ്റ് സി ആസ് വെൽ as ഇൻ ടെക്സ്റ്റ് ഡി, and what are the important words mentioned there. So whether I'm able to complete this A, B, C and D within 2 minutes of time, whether I can read it, ഇതൊക്കെയാണ് നമ്മുടെ മൈൻഡിൽ പോകുന്നത്. അല്ലാതെ ഓക്കെ ഇതെനിക്ക് പോസിബിൾ ആണോ, ഓർ ഇതെന്താണ് മെറ്റീരിയൽ, വാട്ട് ഇസ് എ ടോപ്പിക് ഹിയർ, ദിസ് ഇസ് യു ഡോണ്ട് ഹാവ് ടു ബോദർ അബൌട്ട് ഇറ്റ് ബിക്കോസ് യു ഹാവ് ടു ഡു ഇറ്റ്, അല്ലേ, നമ്മളാണ് ചെയ്യുന്നത്. സോ what you have to do is first of all look into the material, then take 2 minutes for skimming and scanning. So skimming, which means fast reading or speed reading. Okay, ഞാൻ എപ്പോഴും എൻ്റെ സ്റ്റുഡൻസിൻ്റെ അടുത്ത് പറയാറുള്ള കാര്യമാണ്, ആൻഡ് ഐ നോ ദാറ്റ് മെജോറിറ്റി ഓഫ് സ്റ്റുഡൻസ് ആർ അറ്റൻഡിങ് ദിസ് ലൈവ് സെഷൻ. സോ അഗെയിൻ ഞാൻ നിങ്ങളോട് റിപ്പീറ്റ് ചെയ്ത് പറയുന്നു, പ്ലീസ് ഡു സെറ്റ് എ ടൈമർ ഫോർ 2 minutes, 2 minutes ടൈം സെറ്റ് ചെയ്യുക. ഓൾ റൈറ്റ്, ആൻഡ് വാട്ട് വി ഡു, നമ്മൾ എന്ത് ചെയ്യുന്നു, ദെൻ വി ആർ ഗോണ റീഡ് ദിസ് ടെക്സ്റ്റ് ഓർ വി ആർ ഗോണ സ്പീഡ് റീഡ് ഇറ്റ്, സ്കിം ആൻഡ് സ്കാൻ. ഓക്കെ, അപ്പോൾ എത്ര മിനിറ്റിൽ നമ്മളെ കൊണ്ട് വായിക്കാൻ പറ്റി? Okay, so maybe in the first time you guys can complete text C within 2 minutes of time. ചിലപ്പോൾ നിങ്ങൾ സിയിൽ നിർത്തും, അപ്പോഴേക്കും ടൈം കഴിയും. So do practice the same every day. Okay, and after practice, definitely at the end of the day, I mean at the end of the week, maybe 1 or 2 weeks, definitely you can complete part A within 2 minutes. First of all, study what is skimming. Skimming ആദ്യം പഠിക്കുക, സ്പീഡ് റീഡിങ്. ദെൻ യു ക്യാൻ ഫോളോ സ്കാനിങ്. സോ വാട്ട് ഇസ് സ്കാനിങ്? സ്കിമ്മിങ് പ്ലസ് സ്കാനിങ്. സോ അറ്റ് ദ ടൈം ഓഫ് സ്കിമ്മിങ് യു ക്യാൻ അണ്ടർലൈൻ സർട്ടൻ കീവേഡ്സ് ഫ്രം ദീസ് 4 ടെക്സ്റ്റ്. ഓക്കെ, സോ യു ക്യാൻ സ്റ്റഡി ദാറ്റ്. ആദ്യം വായിച്ച് പഠിക്കുക. ഫസ്റ്റ് ഓഫ് ഓൾ ജസ്റ്റ് സ്റ്റഡി വാട്ട് ഇസ് സ്കിമ്മിങ് ഓർ സ്കിമ്മിങ് ഓർ സ്പീഡ് റീഡിങ്. ദെൻ അണ്ടർലൈൻ ദ കീവേഡ്സ് ഫ്രം ദീസ് 4 ടെക്സ്റ്റ്. ക്ലിയർ? So നമ്മൾ പഠിച്ചു what is skimming and scanning within 2 minutes of time. Then the next step is what you have to do is you can take the questions. Okay, and before that just think about, okay, just make a gist about what is text A, B, C and D. Text A il endaayirunnu? I read text A, so what is in text A? ആദ്യം നിങ്ങൾ വായിക്കുമ്പോൾ the problem with the first reading is that when you first of all practice skimming and scanning, you won't understand any single thing because your complete concentration is into what is skimming and scanning. നിങ്ങൾ ആദ്യം വായിക്കുമ്പോൾ കംപ്ലീറ്റ് കോൺസെൻട്രേഷൻ സ്കിമ്മിങ് ആൻഡ് സ്കാനിങ്ങിലായിരിക്കും. അതുകൊണ്ട് എന്ത് പറ്റില്ല, യു കെൻ നോട്ട് അണ്ടർസ്റ്റാൻഡ് വാട്ട് ഇസ് ഇൻസൈഡ് ദാറ്റ് പെർട്ടിക്കുലർ ടെക്സ്റ്റ്. ആ ടെക്സ്റ്റിൻ്റെ ഉള്ളിൽ എന്താണെന്നുള്ളത് നമുക്ക് മനസ്സിലാവില്ല ബിക്കോസ് കംപ്ലീറ്റ്ലി വി ആർ ഇൻ ടു സ്കിമ്മിങ് ആൻഡ് സ്കാനിങ്. Okay, but slowly, maybe after second or third week, you guys will try to understand, okay, what is mentioned there. ഇതൊരു പ്രോസസ്സാണ്. ദിസ് ഇസ് സ്റ്റെപ്പ് ബൈ സ്റ്റെപ്പ് പ്രൊസീജിയർ ഓർ എ പ്രോസസ്. സോ ഫസ്റ്റ് ഓഫ് ഓൾ പ്രാക്ടീസ് സ്കിമ്മിങ് ആൻഡ് ദെൻ പ്രാക്ടീസ് സ്കാനിങ്, ദെൻ കം ടു അണ്ടർസ്റ്റാൻഡിങ്. ക്ലിയർ? ഒരു ദിവസം തന്നെ ഇതെല്ലാം കൊണ്ട് ചെയ്യാൻ പറ്റത്തില്ല. ഐ മീൻ യു കനോട്ട് ഡു ഓൾ ദീസ് 3 സ്കിമ്മിങ്, സ്കാനിങ് പ്ലസ് അണ്ടർസ്റ്റാൻഡിങ് ഇൻ എ സിംഗിൾ ഡേ. ദിസ് ഇസ് എ പ്രോസസ്. സോ പ്ലീസ് ഡു അണ്ടർസ്റ്റാൻഡ് ദാറ്റ്. അതാദ്യം പഠിക്കുക. ഡോണ്ട് ബി സോ റെസ്റ്റ്ലെസ് ആൻഡ് പെട്ടെന്ന് എല്ലാ കാര്യങ്ങളും അങ്ങനെയല്ല. ഇറ്റ് ഈസ് എ സ്ലോ പ്രോസസ്. സോ ഫസ്റ്റ് ഓഫ് ഓൾ സ്റ്റഡി വാട്ട് ഇസ് റീഡിങ്. ഓക്കെ, ആൻഡ് ബി എൻ ആക്റ്റീവ് റീഡർ. ഒരു ആക്റ്റീവ് റീഡറായിട്ട് നമ്മൾ ആദ്യം മാറണം. ദെൻ യു ക്യാൻ മൂവ് ടു ദ ക്വസ്റ്റ്യൻസ്. സോ ഫസ്റ്റ് ഇസ് സ്കിമ്മിങ് ആൻഡ് സ്കാനിങ്, സ്കിമ്മിങ്, സ്കാനിങ്, അണ്ടർസ്റ്റാൻഡിങ്. Then we are coming to what is the meaning of text A, text B, text C, text D. എന്താ കൊടുത്തിരിക്കുന്നത്. Then you can come to the question. 1 to 7 set of questions, and there are a lot of misconceptions about this question category. ഒരുപാട് കുട്ടികൾ എന്നോട് ചോദിക്കുന്നുണ്ട്, മാം ഫസ്റ്റ് എന്താ പറയുക 8 to 14 ചെയ്യണോ ഓർ 15 to 20 ചെയ്യണോ, ദെൻ വി ക്യാൻ കം ബാക്ക് ടു 1 to 8 7 set of questions. Is it correct? അങ്ങനെ എന്തെങ്കിലും ഒരു കോൺസെപ്റ്റ് ഉണ്ടോ? വി ഡോണ്ട് ഹാവ് എനി കോൺസെപ്റ്റ് ലൈക്ക് ദാറ്റ് in OET reading exam. Okay, so it is all about your misconception. നമ്മുടെ തെറ്റിദ്ധാരണയാണ്, നിങ്ങളുടെ തെറ്റിദ്ധാരണയാണ്. So we don't have any kind of okay, ഇതാദ്യം ചെയ്യണം or 8 to 14 first, then you can move to this. There is no such concept. So please do follow a particular thing. ഒരു സ്ട്രക്ചറിലെല്ലാം പഠിക്കുക, and that structure will help you to get 20 out of 20. Okay, അപ്പോൾ ആദ്യത്തെ സ്ട്രക്ചർ എന്താ? സ്കിമ്മിങ് ആൻഡ് സ്കാനിങ്, the first method. Second, understanding everything. Third, reading the question. So how can we read the question? Read the first question. Underline the keywords from the question. Then do understand the question. Just imagine, okay, think about where is it mentioned. എവിടെയായിരുന്നു? Okay, I've read A, B, C, and D. But then എവിടെയാണ് ഇത് മെൻഷൻ ചെയ്തേക്കുന്നത്? So this keywords will help me to identify, okay, which text. Clear? So this is the process. This is the structure or the strategy we are following here. So I am coming to the first question, and please let me know in the comment box your answers also. I can correct you. Okay, madi pidichirikkeruthu. Please do comment it. So first one, advanced techniques to ascertain rhinocerebral mucormycosis. So my keywords are advanced, techniques, as well as ascertain. So these are my keywords from the question. And already today I'm not going to read each and every text. I'm not going to underline the keywords from here because now you guys know what is that. നിങ്ങൾക്ക് തന്നെ അറിയാം എങ്ങനെ ചെയ്യണം എന്ത് വായിക്കണം എന്നുള്ളത്. So I'm not going to read everything in detail. So should I? ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? ഞാനിനി വായിച്ച് ഏതൊക്കെയാണ് കീവേഡ്സ് ഞാൻ പറഞ്ഞു തരണോ? ഒന്ന് കമൻറ്റ് ചെയ്തേ. ഇഫ് യു നീഡ് ഇറ്റ് ഡെഫിനറ്റ്ലി ഐ ക്യാൻ ഡു ദാറ്റ്. അതർവൈസ് ലെറ്റ്സ് മൂവ് ടു ദ ക്വസ്റ്റൻ ആൻസേഴ്സ്. ഇസ് ഇറ്റ് നെസസറി ഫോർ യു ഗൈസ്? What is skimming and scanning? I hope you guys know that, right? On the comment ചെയ്യാമോ whether you guys need to know what are my keywords, how I'm doing skimming and scanning. Yes, Santa. Yes. Okay, no need. Anyone else need that? No need, right? Okay, yes. Yeah, no need because you guys now know how to read and underline everything. Okay, this is a time for, I'm going to check your answers. നിങ്ങൾ എത്രത്തോളം കറക്റ്റ് ആക്കിയിട്ടുണ്ട്, whether you guys are able to know that and whether you guys are able to underline the keywords as well as the answer. Okay, let's see. So first question, advanced techniques to ascertain rhinocerebral mucormycosis. So my keywords, advanced techniques, ascertain. Instead of the word ascertain, they can ask you identify. Identify എന്ന് പറയുന്നൊരു വേർഡ് അവർ ചോദിക്കാം. ഇൻസ്റ്റെഡ് ഓഫ് ഐഡൻറ്റിഫൈ ദേ ക്യാൻ ആസ്ക് യു ഡയഗ്നോസിസ്. ഓക്കെ, ഇപ്പം 3 വേർഡ്സ് ഇപ്പം നിന്ന് പഠിച്ചു. അസർട്ടൈൻ, ഡയഗ്നോസിസ്, ഐഡൻറ്റിഫൈ. ക്ലിയർ? സി, so these are synonyms. So part A, I can say it's all about a play with synonyms. ഒരു synonyms വെച്ചിട്ടുള്ള ഒരു പ്ലേ ആണ് part A. So എത്രത്തോളം synonyms നിങ്ങൾക്കറിയാമോ, that means you guys are experts in doing part A. അതുകൊണ്ടാണ്, that is why I'm saying every single day, please do read anything at least for 10 minutes. Collect some keywords from that, identify the meaning, study the meaning. Definitely it is going to help you, and trust me, you can score 400, above 400. ഓക്കെ, ഒന്ന് ചെയ്ത് നോക്കൂ ആൻഡ് ഒന്ന് കമൻറ്റ് ചെയ്യണം. നിങ്ങൾ ഒരു ആൻസർ കീ അല്ലെങ്കിൽ എന്താ പറയുക, ആഫ്റ്റർ യുവർ എക്സാം വെൻ ദ റിസൾട്ട്സ് ആർ കെയിം, യു ക്യാൻ കമൻറ്റ് ഇറ്റ് ഹിയർ ഇൻ ദ ഫേസ്ബുക്ക് ലൈവ്. ഓക്കെ, എത്ര പേർക്ക് എബവ് 400 കിട്ടി എന്നുള്ളത്. ഡെഫിനറ്റ്ലി യു ക്യാൻ സ്കോർ 400 ഇഫ് യു ആർ എ ഡെയിലി റീഡർ. നിങ്ങൾ ദിവസവും വായിക്കുന്നുണ്ട്, ദിവസവും ഞാൻ എന്താ പറയുക അൺഫെമിലിയർ വേർഡ്സ് അണ്ടർലൈൻ ചെയ്യുന്നുണ്ട്. ഐ എം സ്റ്റഡിങ് ദോസ് അൺഫെമിലിയർ വേർഡ്സ് എവറി ഡേ. ഡെഫിനറ്റ്ലി യു ക്യാൻ ക്ലിയർ ദിസ് എക്സാം, നോ ഡൗട്ട്. Clear? Yes. So answer is mentioned in text B. Very good. How many correct answers? Let me check. Yes, Jonesy, Nimmi, Bonisha, Bose, yes, Trisky, Job, Shanta, yes, Helen, Sinoj, Linda, Jacob, and Anu Thomas. Anyone else? Yes, Gigi. It is from B. Text B. Very good. Text B. And instead of the word ascertain, they have mentioned diagnosis there. And text B is all about rhinocerebral, keyword from the question, mucormycosis, diagnosis, ascertain. And what are the different techniques we are using here? Punched biopsy, histological examination, then CT or MRI. So answer is mentioned in text B. So answer is B. Yes, Anju, very good. Text B. Second one, predisposing factors for mucormycosis. So my keywords, predisposing factors. Yeah. Second question, predisposing. And predisposing is a word that indicates it's not predisposing, it's not related to something pre. It's the key, the synonym I can say is risk factors. Okay, so let me know in the comment box, do you have any other synonym? നിങ്ങൾക്ക് വേറെ ഏതെങ്കിലും synonym അറിയാമോ? Do you know any another synonym for the word predisposing? The word which I know is risk factors. And what about you guys? നിങ്ങൾക്കറിയാവുന്ന കുറച്ച് സിനോണിംസ് ഒന്ന് കമൻറ്റ് ചെയ്തേ ഇൻസ്റ്റെഡ് ഓഫ് ദിസ് വേർഡ് പ്രീഡിസ്പോസിങ്, സോ ദാറ്റ് അതേഴ്സ് ക്യാൻ ലുക്ക് ഇൻ ടു ആൻഡ് ദേ ക്യാൻ സ്റ്റഡി ഓൾസോ. എനി അതർ വേർഡ്സ് യു നോ predisposing? Or you can tell me what is another word that is mentioned in the passage or in the text instead of predisposing factors of mucormycosis. Yes, mucormycosis, or you can say zygomycosis. Yeah, that is the topic. Yes, or another name is there. I forgot at that name actually. It's actually here in my tip of the tongue. Um, it's black infection or something. I'm not sure. Yes, I've heard that. Yeah. So coming back to this predisposing. Any idea what is predisposing? Any another synonyms? No idea. Fine. So answers mentioned in text A. So why text A? Why you guys selected text A? Yes, Gigi, Linda, Anu, Anju, Trisky, Shanta, Helen. Yeah, very good. Which is in text A. Where is it mentioned in text A? Avade evade text A evade kodutirikkune. Predisposing factors, or these are the risk factors which can occur, and these are the factors that lead to this particular condition, zygomycosis or mucormycosis. Where is it mentioned? In text A. So first para, as well as here, zygomycosis is caused by exposure to mucormycete molds. These organisms occur in leaves, piles of compost, soil, rotting wood. Yeah. Okay. And the fungus can also infect your skin. So that is not about the risk factors. Yeah, you can connect with the risk factors or the problems. So we can say text A is all about what is the condition, what are the risk factors, as well as what are the factors that lead to അല്ലെങ്കിൽ ഏതൊക്കെ mucormycete molds ആണ് responsible for this condition. So yeah, that's all about text A. Answer is mentioned in A. Yes, affecting. Okay, Bismi, affecting. Very good, dear. Yes, causes. Yes, sometimes causes. Yes, very good. Risk factors, causes, affecting. Yeah, correct. Then third one, why do zygomycosis survivors need occupational therapist? So why they need occupational therapist, whether they are going for any occupational therapy or something? Where is it mentioned? So then only they need this particular therapist, right? That's evidence mentioned that zygomycosis survivors need occupational therapist. They need a kind of occupational therapy or any other kind of therapy. Where is it mentioned? Yeah, only Shanta got the correct answer, right? Very good, dear. Answer is mentioned in C. Text is C. Any other answers other than this? All right, Anu, Swapna. Yeah, Swapna, dear, it's not text D. It is mentioned in text C. Helen, yes, Helen, very good. Yes, Nimmi, Anju, Bonasha, which is in, yeah, text C. So in text C, as you can see here, physical rehabilitation, and in this one they have mentioned need. Many instances these patients need prolonged course of physical or occupational rehabilitation depending on the degree of their disability. So there they have mentioned they need some kind of therapy. So if they need a therapy, definitely they need the therapist, right? So answer is inferred, I know, but that is mentioned in text C. Very good. Yes, Linda, John C, which is mentioned in text C. Very good. Then fourth one, procedure done for patients presumed to have mucormycosis. So my keywords, procedure, then presumed, and yeah, only two keywords because I know that this is the topic, so I'm not going to underline that one. That is not an important word for me. So my keywords, procedure as well as presumed. What about fourth one? A procedure done for patients presumed, and yeah, so presumed, which means suspected. Suspected to have. Yeah, that is the meaning, I guess. So what about fourth one? Yes. Okay, a variety of answers I can see here. Actually, fourth question is mentioned in text D. That is the correct answer. I don't know whether how many of you got the correct one. Yes, Bonisha, your answer is correct. So sorry, Gigi, it's not text C, dear. It's text D. Yes, I know, not B, Shanta, it's D. Okay, I think only Bonisha got the correct answer, right? Yeah, I think only she got the correct answer. Yeah, Nimmi, yes. Very good, Nimmi. Sorry, dear Helen, it's not B, it is D. And I'll show you where it is, where is it mentioned. It is suspected cases. See? Nasal biopsies from post-COVID-19 mucormycosis, keyword from the question, suspected, presumed, patients. So answer is mentioned in D. That is the correct answer. Then fifth one, the cumulative count of patients with accessible follow-up data. And very easy because you don't even have to look for that, because cumulative count as well as follow-up data study, which is mentioned in text D. So same answer is D. Okay. Sixth one, formidable choice for the treatment of invasive zygomycosis. So my keywords, formidable, treatment, as well as invasive. Yeah, invasive, which means a surgery or something. A lot of correct answers, right? For the fourth question, I thought your answer is wrong. Yes, Helen, risky. Okay, fifth one is D. Yeah, very good, very good. Yes, fifth one is D. So yes, what about sixth one? Formidable choice for the treatment of invasive zygomycosis. Yes, Helen, Trisky, Swati. Yes, Nimi. Answer is from C. Text is C. Because in text is C, they've mentioned all about the treatment. Invasive treatment may be their standard therapy, experimental therapy, as well as it's not from here because physical rehabilitation, nothing to do with invasive procedure, but in standard therapy or as well as in experimental therapy, they can go for some kind of invasive procedure. So that is mentioned here. And formidable, the meaning in the formidable, which I can see some intimidating or what is formidable, intimidating or something necessary, alarming. So that is formidable. So we can say, which is mentioned here, that during therapy varies from weeks to months depending on the site and severity of the infection. So that's here in text is C. Answer is C. Seventh one, the mode of transmission of mucormycete molds be characterized. So the only word mucormycete mold is mentioned in text A. So without even reading once, I know it's from text A. Very direct answer from text A. Yes, that's that. So anyone with 7 out of 7? Yes, Anju, John C. Sixth question from text is C. Seventh one is A. Very good, Shanta. Yes. All right. So anyone with A? 7 out of 7. Okay, Shanta. Yes, Anu, Anju, Swati, Trisky, Helen, Nimi. Seventh one is A. Okay, 6 out of 7. Yes, John C. It is A. All right, Helen, 6 out of 7. So what about that one? Which is that wrong answer? Very good, Anju. 7 out of 7. Yes. All right. 6 out of 7. All right, Shanta. Yes, John C. 6 out of 7. All right, guys. So now we are moving to 8 to 14 set of questions, which can be called short answer questions. So a word is, you can write in a word or a short phrase. Maximum 2 to 3 words. So the first one, what would be preceded by the fungal stains and culture of lesions in the diagnostic steps of rhinocerebral mucormycosis? So definitely we know that these keywords which is mentioned in text B, already we have done a question from text B. I think 2 questions are like, no, 1 question from text B. And lesions, diagnostic step, rhinocerebral. So what would be preceded by fungal stains? So what is the correct answer here? Let me know in the comment box. I already പറഞ്ഞു തന്നു, which is from text B. Yeah, answer in the comment ചെയ്യാമോ? So what is the correct answer here? And the question again, I'll read once again. What would be preceded by fungal stains and culture of lesions? Yes, very good. Hi Santwana, good evening. Yeah. Yes, Linda, you got 7 out of 7. Very good, dear. Very good. Yes, Nimi, 6, pretty good. Yes, Bonisha, 7 out of 7. Excellent. Okay, a lot of correct answer. Answer is punch biopsy. Punch biopsy. I'm very weak with spelling, so that you can check your answer. Punch biopsy. Answer is mentioned in text B, and this is my answer. I found the answer here. Punch biopsy of this lesion keyword followed by fungal stains. Another keyword, culture. See? So answer is punch biopsy. Very direct answer. 9th one. Yes, how many correct answers? Yes, Jonesy, Linda, Bonisha, Nimmi, Anju, Shanta, Helen. Anyone else? Yes, Sopna. Very good. Punch biopsy is the answer. Okay. 9th one. In terms of infusion site concerns, the nephrotoxicity which form of amphotericin B exhibits fewer problems. So my keywords, infusion, nephrotoxicity, as well as amphotericin B. So amphotericin nephrotoxicity, which is mentioned in text is C, I guess, because I've seen that keywords there in text is C, nephrotoxicity, as well as amphotericin B. So any guess? What is the correct answer? And I'm very sure answer is from this particular paragraph, because yeah. Any idea, guys? Any guess? What is the correct answer? A little bit tricky, I know. In terms of infusion site, yes, which form? Answer choദിkkuna which form aanu, but so don't repeat form in your answer. Which form? Yes, liposomal or liposomal. Very good. Liposomal, liposomal or liposomal, and that's mentioned in text C. Oh no, yes. See, both conventional and liposomal amphotericin B are effective against it. The liposomal form, a very direct answer, offers less infusion site. Keyword. Side effects and milder nephrotoxicity. So answer is liposomal form. So form is already there in the question, so that you can write liposomal. That is the correct answer. Yeah, എത്ര പേർക്ക് കറക്റ്റ് ആൻസേഴ്സ് കിട്ടിയെന്ന് നോക്കട്ടെ. ജോൺസി, ജിജി, സ്വപ്ന, ലിൻഡ, അനു ആൻഡ് പിന്നെ അഞ്ജു, ഹെലൻ, ട്രിസ്കി, നിമ്മി, സ്വാതി. Very good, very good. A lot of correct answers. Very good, guys. Okay. Yes. 10th one. What is the term for the infection fighting white blood cell variety? Term infection fighting and white blood cell. Yeah, white blood. So where is white blood cell and infection fighting mentioned? Any guess? ഏത് ടെക്സ്റ്റിലാണെന്ന് കമൻറ്റ് ചെയ്യാമോ? ബിഫോർ കമൻറ്റിങ് യുവർ ആൻസർ ലെറ്റ് മീ നോ വിച്ച് ടെക്സ്റ്റ്. ഇൻഫെക്ഷൻ ഫൈറ്റിംഗ് വൈറ്റ് ബ്ലഡ് സെൽ വെറൈറ്റി ആണോ? ഇസ് ഇറ്റ് ന്യൂട്രോപീനിയ? ഷുവർ, ന്യൂട്രോപീനിയ തന്നെ ആണോ? ഓക്കെ, ഐ അഗ്രി. ആൻസർ ഇസ് മെൻഷൻഡ് ഇൻ ടെക്സ്റ്റ് എ. യെസ്, കറക്റ്റ്. In text A. Yeah. Yes, Helen, Anju, Shanta. Yes, Anu. Yes, Nami, it is in text A. So let me know your answer. My keywords: infection fighting, white blood. What is the term for that? Adina endu pera kodukkunne avaru in text A? Sugarmycosis. It's a very serious condition, also known as mucormycosis. This infection tends to occur most often weakened immunity from an illness or a health condition. People with uncontrolled diabetes, people level of neutrophils, a type of blood cell that helps the body fight off infection and heal itself. Healing itself, that is called neutropenia. The term which is called neutrophils, not neutropenia. I'm so sorry. Answer is neutrophils. What is the term called? Okay, that term called neutrophils, not neutropenia. So neutrophils is the correct answer. I think nobody got the correct answer, right? Arkengilum gottiyo? So neutrophils, Neutrophils, neutrophils. 11th one. With the assistance of a head scan, which components level can be discerned? Discerned, which means identified. Okay, with the assistance of head scan, which components, ഏത് componentന്റെ ലെവലാണ് നമ്മൾ കണ്ടുപിടിക്കുന്നത്? Which components level can be discerned, identified? Yeah, ഒന്ന് കമൻറ്റ് ചെയ്തേ. Which components level can be discerned? ഏത് componentന്റെ ആണ്? 11th question, and answer you guys know. I think you guys know the text. It is in text B. ഇനി ഒന്ന് കണ്ടുപിടിച്ചേ. വാട്ട് ഇസ് ദ കറക്റ്റ് ആൻസർ? വിച്ച് കമ്പോണൻറ്റ്? ഇവിടെ ഏത് കമ്പോണൻറ്റിനെ പറ്റിയാണ് കൊടുത്തേക്കുന്നത്? യെസ്, വെരി ഗുഡ്. യെസ്, level is already there in the question, so please don't repeat the same word. Answer is air fluid. All right, answer is air fluid. Head reveal air fluid level in the sinus and the involvement of deep tissue. So answer is air fluid. That is the correct answer. Yes, a lot of correct answers. Yes, don't write level, okay? Please don't write the level there, because already level is there in the question. നമ്മൾ ക്വസ്റ്റനിൽ കൊടുത്തിരിക്കുന്ന ഒരു വേർഡ് പോലും നിങ്ങൾ റിപ്പീറ്റ് പോകരുത്. If it is a name of something or a countable noun or a percentage, you can repeat. Otherwise, don't repeat. So answer is air fluid. And don't forget to put the hyphen also. A hyphen illengil your answer is wrong. Air hyphen fluid. That is the correct answer. 12th one. What is the cutting edge adjunctive therapy with a potential role in mucormycosis treatment? So treatment, adjunctive, cutting edge. Yes. So these are my keywords. Or you can underline instead of adjunctive, therapy you can underline. Okay. Therapy nallathu ningal mark cheya. Yep. So cutting edge therapy treatment. Where is it mentioned? Cutting edge therapy treatment, which is mentioned in, I have seen that words somewhere in this para. Okay. Uh, Iron chelation is a novel which means new, something new, fresh. Adjunctive therapy that has potential role in the treatment of zygomycosis. So I got the answer very directly from here. Iron chelation. Answer is iron chelation. IRONCHELATION. That's that. Yes, Gigi. Yes, Shanta, Swati, Trisky, Helen, Nimi. Yes, Swapna. Very good. Yes, Linda. Iron chelation. And if you guys are starting with the first letter capital, always follow to the rest of the questions. Okay, don't forget that. Yeah, 13th one. In the event of a cut or burn, how to articulate the transmission of infection when the fungus infiltrates the skin. So my keywords: articulates, fungus, infiltrates. Or you can underline cut or burn, transmission, fungus infiltrates. Alright. So yes. Cut or burn, I've seen that word somewhere here. In text A. Yeah. See? The fungus can also infect your skin. That is infiltration of the skin. Via a cut or burn. Cutaneous exposure. Very direct answer. So answer is cutaneous exposure from text A. Cutaneous exposure. So this is my answer from text A. Only Chanda got the correct answer, right? Oh, Nimi. Very good, Nimi. Yeah, very good, Swapna. It is cutaneous exposure. Yes, Bonisha, very good, dear, which is from text A. Yes, Trisky, Helen. Yeah, correct answer. Yes, Gigi. Very good. 14th one. What biological structures were identified in the outcomes of 171 biopsies? So my keywords: biological, 171 as well as biopsies. Alright, yes. And I'll give you a reminder. I don't know how many students are attending this live session. I mean, my students, as well as from a lot of students from other, institutions and academies. So whatever. You guys are, for me, everybody is watching this live session, my students. Alright, students are. So I'm just reminding you something. Whatever you have invested, as in the form of money, as well as in the form of hard work, it is important for you. Okay, നിങ്ങളത് എന്ത് രൂപത്തിലാണ് ഇൻവെസ്റ്റ് ചെയ്തേക്കുന്നതെന്നുള്ളത് I don't have any idea. If it is in the form of money or if it is in the form of hard work. ചിലപ്പോൾ നിങ്ങളുടെ ടൈം ആയിരിക്കും നിങ്ങൾ ഇൻവെസ്റ്റ് ചെയ്തിട്ടുണ്ടാവുക അല്ലേ. If you guys are attending online class or offline class, whatever, the time is there. You guys are investing your time. അല്ലേ, നമ്മൾ വർക്കിന് പോകുന്ന അല്ലെങ്കിൽ ദാറ്റ് ഷിഫ്റ്റ് നമ്മൾ ചെയ്യുന്ന ഡ്യൂട്ടി എവറിത്തിങ് വി ആർ ഇൻവെസ്റ്റിംഗ് ഹിയർ. Why? Because the only aim is, or the only priority is to clear this exam. Okay, so please do think about it. അതിനെപ്പറ്റി എപ്പോഴും you have to focus on that, അല്ലെങ്കിൽ you have that particular thing, that thought. ഓക്കെ, എപ്പോഴും അതിനെപ്പറ്റിയുള്ള ആ ഒരു ചിന്ത, ആ ഒരു തോട്ട് വേണം. ഓക്കെ, ഞാൻ പഠിക്കണം, I should clear this exam. I am just investing my time, not only money. പൈസ മാത്രമല്ല. Okay, you can create money or you can earn money if you are doing some job or something, but it's not about money. Your time is there. പോയ സമയം പിന്നെ തിരിച്ചു വരില്ല. Okay, so please do remind that. ഓരോ ലൈവ് സെഷൻസ് കാണുമ്പോഴും please do attend the live sessions completely and find out the answer and do some effort for finding out the answer. ഇപ്പോൾ കിട്ടുന്നില്ല, എല്ലാവർക്കും ആൻസർ കിട്ടുന്നു. Everybody is commenting answers. I'm not getting any answer here. Why? Because you guys are in that basic level. നമ്മൾ ആ ലെവലിൽ എത്തിയിട്ടുള്ളൂ. So we have to improve. What we can do for that? You can do some hard work. So read. Take some time for understanding the text. So don't set the timer first. അത് വായിക്കുക, മനസ്സിലാക്കുക. Just understand some keywords or underline some unfamiliar words. Find out the meaning. Study it. Definitely you can improve. Okay. So please do keep it in mind. This is my priority. I should study it. Okay. So don't be lazy. Yeah, so 14th one. What biological structures were identified in the outcomes of 171 biopsy? So biological structures, 171 biopsy. And I know these keywords mentioned. I've seen these keywords in text D, I guess. Yes, here, 171 biopsy. And so my answer is a very direct answer, fungal hyphae. Okay, so that is the answer, which is from text D. So answer is, I started everything in capital, so I'm just continuing the same. Fungal, HYPH, EA or AE? AE, I guess. Yeah, so that is that. And something is missing, right? I think there is an H in between. PHAE. Alle. Yeah. Okay. So that's that. 15th one. Dash is less severe with the liposomal form, making both conventional and liposomal amphotericin B effective with fewer infusion site issues. Same pattern. I mean, not same pattern, same sentence. നമ്മൾ ഓൾറെഡി വായിച്ച ഒരു ക്വസ്റ്റ്യൻ ആയിരുന്നു ഇത് ആൻഡ് സെയിം സെൻറ്റൻസ് ഇസ് മെൻഷൻഡ് ഹിയർ. സോ ആൻസർ ഇസ് സി ഡയറക്റ്റ് ആൻസർ ഓൾറെഡി ഹിയർ നെഫ്രോടോക്സിസിറ്റി. That is the missing word, alle. All other keywords are there. So the only missing word is nephrotoxicity here. So answer is mentioned in text C and that answer is nephrotoxicity. N should be capital because it is the starting of a sentence. I think NEPHROTO toxicity. Yeah, a lengthy word. Yes, very good. Yes, Anju. Yes, Jiji. Yes, Timmy, Trusky. Yeah, nephrotoxicity. Yes. 16th one. Officially, dash it tends to surface more in those with compromised immunity from underlying health adversities. My keywords comprised. Is it comprised? Compromised immunity and health adversities. Yeah. So what about this one? Officially, dash it tends to surface more. So we are talking about the condition called zygomycosis, right? So definitely it is either you can write zygomycosis or you can write mucormycosis. Both are correct. Okay, it is also known as infection tends to occur most often, have a weakened immunity or dash and dash. So either we can write zygomycosis or you can write mucormycosis. Both are correct. That is the term. Then 17th one. In recent findings, dash an orally administered azole demonstrated promising results against mucorales species with a score less than 100. So something less than 100. I've seen the numbers mentioned in text D as well as numbers mentioned in text C, and I have not seen any numbers in text A. No, right? As well as in text B. Yeah, no numbers mentioned. So either text C or text D, and species mentioned in text C, I guess. Yeah, and mucorales, one of the keywords. Species 99, less than 99. So answer is, what is the correct answer here? They are talking about something. The orally administered posaconazole, right? I don't know how it is pronounced. I think it's the name of a medicine. Yeah, it is a posaconazole. And in recent findings, dash, yeah, orally administering, that is the medicine. So answer is POSA, posaconazole. I hope the spelling is correct. ZOLE. Yeah, so posaconazole. Then 18th one. Yes, posaconazole. Yes, Swati, Trusky, correct answer. Yes, Linda, very good. Yes, Helen, right answer. Then 18th one. Infection is classified as sinus exposure upon inhaling dash in the air. So what is in the air? A very direct answer, mold spores in the air. Without even reading, I know that because already we have collected some keywords, right? If you have collected keywords, definitely without even reading, you guys will get the answer. So answer is mentioned, I guess, in text A. And infected mold spores. So answer is here. Okay, mold spores. And 19, the presence of characteristic broad branching hyphae invading the tissue is disclosed through dash. So what is that? And 19th one, disclosed through what? So disclosed through some kind of any examination or any procedure or any technique. So I think so, which is from text B, because the techniques mentioned here, histological examination reveals the characteristics broad. Yeah, very direct answer. See, everything is mentioned directly. So histological examination, that is the answer. And 20, successful recovery was experienced by dash patients treated with antifungals based on the high suspicion from imaging. And my keyword, successful antifungals as well as imaging. So again, so what was that? 20. Any idea? Any guess? 20th question answer on the comment cheyamo. Any idea what is successfully? Yeah, yes, Gigi, this historical examination. What about last question? 20. 20, it is little bit tricky. Successful recovery was experienced by dash patients. The patients are, I know, I don't know, name of a patient. I don't think that is name of a patient, but maybe number. Very good. Either you can write 03 or you can write 3. Both are correct. Okay, there is no need for writing 0 in front of the number, but usually we are writing 03 to indicate it is a single number. Yeah. So 3 or 03. Both are correct. And which is a direct answer from text study. So that's all about that. And I don't know how many of you got 20 out of 20. That's not a problem. So yeah, so we have to do it, read it, and after this live segment you can take the material once again, just read it once again, underline the unfamiliar words, so you can find out the meaning through Google it. Yeah. Okay, so that's that. I hope this session was helpful for you. So that's that. See you on Wednesday, same time. So there are some changes in the live segments, but I'll just give you the time. Reading will be 6:30 Monday, Wednesday, Friday evening 6:30. Thank you. Take care.